Dr. Seth Hornak, founder of Dr. Seth's line of vitamins. We're going to talk today about stress and anxiety, and this is something that I see on a daily basis with patients. It's one of the most common complaints, I would say, especially since the pandemic. Everybody seems to be on edge, and there's just a lot of unknowns about kind of what's going on in someone's life and also in the future as well. So we kind of have a general workup of different things that we kind of look at that kind of contribute to stress and anxiety. From a chiropractic kind of structural basis, there is a nerve that wraps right around the base of the skull called the vagus nerve, and the vertebrae associated with that is the atlas or C1. And when that basically rotates out of position, it'll put pressure on the vagus nerve, which can trigger anxiety. It'll affect blood pressure, heart rate, stomach functioning, lung functioning. So there's a chiropractic technique called NUCA, National Upper Cervical Association, and only adjusts C1. So there's kind of easy ways to assess C1 to see if it is in alignment or if it's out of alignment. We do a simple muscle test using a muscle group in the shoulder where the nerve supply comes from for that particular area, and we can know exactly if it's in place or out of place, and that's helped kind of hundreds of people really improve their stress and anxiety from a structural basis. And basically C1 is a ring and C2 is a ring with a post on it. And it would almost, if you're looking at like a top-down view, it basically just rotates, C1 rotates on C2, called the dens. And so when you're rotating kind of to the right side, the vertebrae has to rotate like this. So you're turning like a steering wheel this way. When you rotate to the left, it goes the opposite way. So it has to kind of shift back and forth. And a lot of times what will happen is it sticks forward on one side. One thing that you could note, if it's hard to turn your head kind of to the right side, we know that vertebrae is stuck forward on the right because it's supposed to kick backwards as you're turning to the right side. And the same thing when you're going to the left side, you would rotate like this and the vertebrae would shift kind of like this. So we know that your C1 would be stuck forward on the left side and backwards on the right side. So that's a simple way that someone, if they weren't in to get adjusted, that they could kind of do. So what you could do to kind of assess that on yourself, or even just to get it moving. So when I'm turning to my right side, I would push backwards with my right hand and forward with my left. And when I go to the left side, I'm going to push backwards with my left hand and forward with my right. So I'm kind of just working this back and forth. And that's something easy that we can all do on a daily basis to keep everything limber and flexible. And you're not going to hurt yourself doing that at all because that's normal motion of the spine. Some people also get like massage guns, and those are decent to use. So basically, as you're turning your head to the right side, all your segments are supposed to shift back to the left. So you could take your opposite hand and reach and kind of pull towards midline while you're turning your head or putting your ear down. When you turn your head to the left side, you could actually take your opposite hand, you're reaching behind, pulling towards midline while you're turning your head or putting your ear down. So so it kind of look like this. You're reaching across and pulling while I'm turning to the right or midline. When I'm going to the left side, I'm just pulling again towards midline. Or you could have someone else actually kind of push these side to side as well. Do you mind coming over here, Sarah, and I can just kind of demonstrate that as well. So we have Sarah here, and I'm just going to demonstrate for her. So you can actually just face this way. So I'm going to move your hair out of the way if you don't mind. Is that okay?
Yeah.
So turn your face to the right. So as you turn to the right, all these segments are supposed to shift back to midline. So I'm going to push them towards midline here. When you go back to the left side, they're supposed to shift backwards. So I would be pushing them this way, go back to the right side, and go back to the left side. And then if you were actually doing it on your own, you would take your right hand or left hand, you're going to reach across and pull towards midline, turn your face to the right. You can take this hand on your head and rotate to the right side. So we're kind of just getting a good motion there. And then turn your head to the left side again. You're going to reach across with your opposite hand, and she's just turning and pulling towards kind of midline with both of those. So those are pretty easy, right?
Yes.
And then if you had it like a massage gun, what you would do as you're turning your face to the right side, she would hold the massage gun here and actually just push directly this way. When you're going to the left side, you would have the massage gun over here, and you're just pushing all these segments kind of towards midline directly. So we always want to get motion back in the spine. And then the same thing, if your C1's not moving, you would take your right hand, you're going to push kind of backwards here and turn your face to the right, to your right actually. There we go. And then pull this forward. So you're just kind of pushing that So she's pushing backwards here and pulling forward on the opposite side. Turn your head to the left side. You're going to push backwards here and then pull forward on that side. So you're just getting that moving back and forth. That's something easy you can do on a daily basis just to kind of get that moving. Does that make sense?
Yeah.
Now, other things we can do to help kind of stretch the neck out, we want to get good curve back in your neck and also get good flexibility as well. So as we age, we tend to hunch forward. We call it like tech neck, where your head's kind of coming forward. So what you can do to kind of help with the curve, you can do a nice, easy exercise, the turtle, where you're emphasizing kind of the backwards motion. You just go, and you can hold each rep directly for 5 to 6 seconds. You can even cross your arms and do that same motion. So you're just kind of going directly backwards. Perfect. You could also roll up a towel and just lay on it. You'd be on your back, and you hold that for maybe a minute or two. You could go into an inside corner and do like a corner hold, where you would kind of come into this area. You'd hold that position for maybe 30 seconds or so. Another thing, you can actually go into a doorway and actually just hold that position against the door as well. And then one of my favorites is the military position, where you're actually just kind of holding yourself against the wall for 30 seconds to a minute. I usually do it for like 30 straight seconds, but what you could actually do, you'll stand with your feet shoulder width apart, and you're just going to make sure that your toes are straight and not like turned in or out. And then you're going to tighten your quads, your abs, open your hands up, and then pull your head backwards. You can do this against a wall as well. You can hold that for 30 seconds. I like to do it for 5 consecutive breaths. You'll kind of move your arms up each breath, finishing in like a touchdown position. So not too hard, right?
Nope.
And then the next one that we can do, we also do this sunrise movement, where you're basically going to bring your arms up as high as you can. Elbows will be straight and you'll just open. So it's pretty easy, pretty straightforward. And then the next one is the praying nuns. You're basically in the same position. On that exercise, your elbows are straight. We're going to bend our elbows on this one. So you're going to bring your arms up. You're going to bend your elbows and do like a lat pull down, where you're actually pulling back. You'll try to squeeze your shoulder blades together, so that feels pretty decent as well. Any questions with those at all? And then there's another exercise I like. It's called the breathing eagle. It's also really good for kind of posture. What you do, you'd be in this position. You're basically going to take a breath in and blow it out. So you're breathing in and opening up, and then blowing it out. So it's just really good to open up the spine. And then the next one's like the crucifixion position. So you're basically going to be in this position. You're going to take a breath in, but your elbows are straight, and then you're blowing it out. So you're just really opening. We're trying to open up the spine and try to fight some of that forward dominant posture. Another thing, we call it like skydiving or the Superman. Basically, if you were face down and you had your thorax against the bed, you would actually go in like a backwards U position, almost like you're skydiving. You can hold that. That's pretty intense for people, but it tends to work all pretty well though. And then we'll go over another one. One of my favorites is actually called the dead bug, and I'll demonstrate actually on this table first. So I'm going to take my coat off for this real quick. But okay, so I'm just going to move this back a little bit. And you've never done this exercise, right?
I don't think
bug.
so.
It's kind of a funny exercise, but so I'm going to lay on my back. I'm going to assume the normal dead bug position, which everyone knows is like this.
Yeah.
And you're going to bring your opposite arm and leg backwards.
Okay.
So it actually is harder than it looks.
Right.
You're going to push your kind of pelvis down into the table. So why don't you try that one? You can lay on your back. You're going to assume the dead bug position, so your arms are up. And then you're going to bring your opposite arm and leg. There you go. And then you'll go the opposite. So you want to try to just use so you're going to do those two, and then the opposite two. Now, one thing, it's hard. Do you see how your arm moved a little bit? So what you can do, again, I'll hold these two, move your opposite two, and then come back to neutral, and then move your opposite two. It's hard. You kind of want to move the arms and legs at the same time, but that's good. There you go. And you'll get into a rhythm with it. But it's good for the gait patterns as well to kind of do the opposite. So Good. And I'll try it without me holding. See if you're a little bit better now. There you go. Perfect. And then your opposite. Good. And the more you do it, the easier it'll get. But it's kind of hard because you want to like run, just kind of you move your upper with the lower. But it's so if someone holds the opposites, it's kind of let your mind focus on doing that properly. So okay, so I'll help you up. Good. And then the next thing we're going to do, next stretch wise, would be the 7-7. So let's stretch our neck in 7 different planes of motion. So we're going to start just by stretching directly downward. And then you can stretch backwards as well. So you put your hands on your forehead and just stretch backwards. And then you're going to reach across and do a side stretch. And then also the opposite way as well. Now, when you're doing a side stretch, what you could also do, I like to do, it's almost like a partner stretching you. So ideally, I would want your arm up and I want to stretch a patient this way. So if we want to simulate this motion, what you can do, if you came kind of against the wall and you could put your arm against the wall while you're kind of doing some stretching. Or in a doorway, the same thing. It kind of allows you to get a better, you open up the brachial plexus a little bit better. And then we can also do a stretch where you're turning your head to the side and trying to pull your ear to your, so you turn your head this way, and then take this hand and just stretch directly down towards midline. Good. And then turn your head to your left side, and then reach and pull directly to midline. Perfect. So you can feel that directly down your spine. And then you can do a head lift. You'll take your thumbs and actually just place it right underneath the base of your skull or your occiput, and you're going to lift up kind of vertically. So it's kind of an interesting stretch. And then we want to do a little bit of a resistance work as well. So with the resistance work, we're just going to push into our hands. So we can push kind of forward. And then you can push backwards. You can push into your left side, into your right side. And then like you're turning and driving a vehicle, so you can push turning to the left and to the right, and then jaw resistance. So we just call those the 7-7-7 ways to stretch and also strengthen your neck. So these are going to help kind of keep your C1 in good alignment and get good flexibility from a structural basis. So you feel comfortable with those? Yes. And we have other links. We'll have a link on the description of some of those exercises. And then we make other videos also on like cervical stretching and neck exercises. But so that's good for this. And then also, basically with stress and anxiety, so we want to address the structural things. We kind of just talked about that now. And then we always look at like 3 different things. We want to detoxify the body typically. So toxins will tend to accumulate in fat tissue, especially in the brain. So we want to pull as many toxins out as possible. Greens are one of the best ways to cleanse. We use something called Power Greens. It's a powdered drink. It actually tastes really well. Doesn't look really good, but it does taste decent, especially if you mix it with really like cold water or cold juice. And then we use something called Power Liver Cleanse, and this runs all 3 phases of liver detoxification. So generally, like cirrhosis of liver is fatty liver. So what we want to do is convert those fat toxin molecules to water soluble, and we want to be able to flush those out of the body. So Power Liver Cleanse really does a good job of pulling a lot of garbage out of the body. We've actually seen liver enzymes drop like 100 points in a week using this. Normal liver enzymes are between 30 and 40. We've seen people between 300 and 400. They go on the liver cleanse and their numbers come down to normal. So it does a good job of really flushing garbage out of your body. It also can help with weight loss if someone's doing like a ketogenic style diet or a diet where they start losing weight and then they plateau. They really can't lose more weight. Generally, when we do a liver detox and start flushing the poisons out of their body, and then they'll start losing weight again, because the body really basically doesn't want to remove those toxins because it's trying to protect the body from those toxins. So if you don't have a mechanism to get rid of them, then it's not you're going to hold on to your fat. So we want to try to push the garbage out of the body. So that detoxification is an important step in kind of helping anxiety and stress. And then we know that 90% of your brain neurotransmitters are produced by the gut. So melatonin, serotonin, dopamine, acetyl-CoA, GABA, these are the 5 main neurotransmitters. Serotonin actually makes you feel good. They've done studies to prove that 95% of your serotonin production is actually from the gut. So digestive function and stress, anxiety, depression, they go hand in hand. So we really have to make sure that a patient's digestive tract is on point and really functioning well. And then also, if you have a little bit of a leaky gut, it also leads to toxins going into the system, because when the gut's leaky, the toxins will go into the system. It goes to the liver. The liver has to filter, and then the blood goes to the kidneys. The kidneys filter, then fresh blood goes to the heart. So it goes GI tract, liver, kidneys, and then heart. So by fixing digestive functioning, you're also lightening the load on the liver and the kidneys, and then it all kind of ties together. So we really want to look at the body as a whole, not just one particular area. So patching the digestive tract is really good. We use a product called Power GI, and it would be like if you take your forearm and brush it off a brick, it might irritate and cut my forearm. But instead of, I probably wouldn't put bandages on there, but I would maybe put like coconut oil or aloe or Neosporin or something on there, and that's what the Power GI does. It actually patches the lining of your digestive tract. It's phenomenal for like IBS, any kind of heartburn, GERD issues, diarrhea, constipation. It just really helps to soothe. It's really big for anxiety, stress issues. And we want to put the really good flora back in. We really have settled on a product called Power Biotic 52 because it's very strong. First of all, there's like 9 different strands of implants in most of your digestive tract. There's also a prebiotic in there, which feeds the bacteria, keeps it very healthy, and it's really good for people of all ages. Even my kids take that, even though it's a very strong one. We even open it up. You can dump it into food, but most adults actually swallow it as well. Also with the digestive tract, if somebody's getting a lot of bloating after eating, generally they have a lot of high candida yeast. So we want to kind of knock that candida yeast down. 1 in 2 women are high in candida yeast. 1 in 4 men are high in candida yeast. So we use something called Power SBC, which actually like lacquers the inside of the digestive tract, so the candida yeast, they don't stick. And we do another thing called Candida Whey, which helps to knock the candida yeast down. And there are reactions called Hertzheimer reactions that can get you a little bit sick if you start to kill candida yeast with something called like Candida Whey. So, but the SBC eats up the die-off from the Candida Whey, and so you can kind of do the SBC by itself. But if you are doing a Candida product, you really want to do the SBC with that as well. If bloating is an issue, Candida yeast can also show up in a sinus issue, so it can be like chronic sinusitis. Itchy inner ears is another sign of Candida yeast. If someone has eczema or any kind of skin issues, a lot of times it's Candida yeast, so we want to kind of knock that down as well. And then also the Active B vitamins are very important for the neurotransmitters. They are catalysts to form the neurotransmitters, so they actually help reactions that take place to form these neurotransmitters. It's very important. We use 3 different products for the Active Bs, and you only need to do one of those 3. Our Power Energy Multi is loaded with the Active B vitamins. When you go to a vitamin, you always want to go to the B6, 9, and 12. You want to make sure that that you're taking an active form, which would be the methyl form. So the active form of B12 is methylcobalamin. The inactive form is called cyanocobalamin. The active form of B9 is not folic acid. That's the inactive form. You want to do methylfolate. And then the B6, the active form is P5P as well. So those are, when you go to a vitamin, you go right to the 6, 9, and 12 and see if they're using the methylated forms, and those are generally the better forms, or more absorbable, more active forms. So we have a Power Energy Multi that's loaded with the B vitamins. There's also 2,000 units of D per capsule and 50 milligrams of CoQ10. So it's a really good all-in-one. There's a little bit for your eyes in there. The Power Methyl Energy has really high levels of the Bs. There's also something called TMG in there, which is a big detoxifier for the liver. It turns into DMG, which helps with your arthritic markers in the bloodstream. It helps boost the T cells that fight infections, and it was helping big time with neurological detoxification. And then the Power Methylfolate B12, that's a chewable B12 9 in the active form. It's great for someone that wants to put like a chewable underneath their tongue and just absorb it. You can do that a couple times a day, and it's great for kids as well, and they taste tremendous. So that's a really good 3 forms of the Bs. You want to keep your Bs really high for the brain and also for energy. And then you can take direct precursors to the neurotransmitters. Again, the neurotransmitters are GABA, serotonin, melatonin, dopamine, and acetyl-CoA. So there are different amino acid blends that are precursors to those. A lot of times, if the neurotransmitters are low, people have sleep issues. So if someone's not sleeping, we always think of two things going on. The digestive tract's off because 90% of your brain neurotransmitters are produced by the digestive tract, or the adrenal glands are stressed. And the adrenal glands, renal means kidney, adrenal are the glands on the tip of the kidney. They make your adrenaline, your fight or flight hormones. They control, they can raise blood sugar, and a lot of your stress, basically. So I do an adrenal support on a daily basis. My one daughter's doing an adrenal support now. It's helped her tremendously, and hundreds of our patients have been helped with adrenal supports. And it's one of the biggest things for anxiety, stress. If you're burning the candle at the both ends, if your diet's poor, you're just not able to sustain all these neurotransmitters, then the adrenals, that's usually a way to really check that and get good functioning or get good results almost immediately. Another sign, if someone has really bad adrenal issues, when they get up quickly, generally they will get lightheaded. If it's really bad, that's a very severe adrenal case. So they would be like, if they got up just really quick from a lying to a standing position, their blood pressure will drop, because the adrenal glands would cause your blood vessels to constrict down a little bit. So you wouldn't have enough adrenal hormones, so your blood vessels would stay a little bit wider and you would get lightheaded. So that's kind of, if someone wasn't able to get tested, then they would want to go on an adrenal support. And then the brain is mostly fat, so we want to use a lot of good fats. Dietary wise, salmon, we usually use organic salmon and wild caught as opposed to farm raised, which isn't as good. Coconut oil is very good for the brain. We use Power Omega 3D. We use an omega product that goes through like a 7-step filtration process, so it pulls a lot of the toxins, all the toxins and garbage out of the product. So I think if you're getting a good quality like supplement, the fish oil, that type of omega product is probably the most important to get one that's really filtered well, because the fish can be loaded with toxins. And we use another product called Power Brain Memory that really can help. There's like 4 research ingredients in there that have shown to really help support healthy memory function. It can help with kind of stress and anxiety, because that's brain related. And obviously the spiritual aspect of things with prayer and just kind of those type of meditations, I think are really important as well. But from a structural basis or like a chiropractic basis, I really think like working on the upper cervicals would be good. Detoxification definitely helps. Upregulating the brain neurotransmitters from healthy digestive function with the Power GI, Power Biotics, seeing if somebody has Candida yeast, taking care of that with the SBC. The Candida way, we also use a low carb diet with that as well, because sugar feeds Candida yeast if someone is having a lot of bloating. The active Bs are essential, and then checking the precursors, which would be some of the amino acid blends, and then adrenal function and the good fats. That's kind of a sure way to really help somebody with stress and anxiety. So sometimes it's a combination of a couple things. Someone might say, hey, my digestive tract's really off, but I'm also getting like panic attacks. So the first thing I always ask somebody, hey, are you taking any pharmaceuticals for this? So if someone's doing like the SSRIs, which are called selective serotonin reuptake inhibitors, you can just Google this, SSRIs. Wellbutrin is one of them, the different antidepressants. And basically, that is a precursor to serotonin, so you don't want to do some of the amino acid precursors because it's too much for that system. Other people are on generally a category of drugs called the benzodiazepines. It's like Klonopin and different. There's a few that are pretty common, but they're the benzos if you look those up on whatever medication you're taking. Now, if someone is on the medications, then we can do a few things for them. We can still do the active Bs. We can still fix digestive function with like the probiotics, the Power GI. We use one of the Bs, and then I use something called Power Stress. Now, I love the Power Stress formula. It's actually a research type of L-theanine, and this is amazing. Anybody can take it. You can take it with medication, but what it does, it helps to inhibit the neurotransmitter that causes anxiety and panic attacks. So generally people take 2 of these Power Stresses a day, one in the morning, one in the evening. If they are having a direct anxiety attack or panic attack, you can take 2 of these, and usually within like 10 to 15 minutes, it usually really dissipates or goes away. So it's just a really nice way that someone can get on something quickly with their medications, and it can make a big difference. But if someone wasn't doing the medications, we can still do this. We can still fix the gut. We can do the active Bs, and we can do the direct precursors as well, and you can do the good fats. So I would say with medications, you can do the power stress, the good fats like the omega-3D, and the active Bs. If you're not doing the and also gut functioning, like the good probiotic blends, those type of things. And if you're not on a medication, then we can actually throw in the precursor neurotransmitters that we use as well. So I hope this video helps, and as always, please like and subscribe to our videos. It really helps us out, and when you do that too, we'll make sure that you're notified of new videos that we're producing as well. Thank you so much for your time. We appreciate it. God bless.